What strikes you about when the emergency ends that is going to impact healthcare the most?
I think if you've not stayed on top of this or hadn't had a reason, or perhaps you're just too busy actually caring for the COVID patients, you don't realize some of the things that are tied up in the PHE. Just from a hospitalist perspective, there's extra reimbursement that was tied to every COVID admission and discharge. There's a 3-day requirement, an inpatient requirement to get Medicare patients into SNFs that we're all used to on the inpatient side of the house that is currently suspended. And so we used to finagle all sorts of reasons to admit patients to try to get them into a nursing facility. And right now that friction is gone, but will resume the second the epidemic is declared over. And then there's all sorts of things in terms of easement or the easing of regulations on telehealth, reciprocity across state lines, things like that, that would certainly evaporate once this is over, unless, and some states have done this, unless states have enacted their own new legislation to sort of keep the momentum going. But there is a lot of dollars that are tied up in the PHE right now. And I agree, the graphs and the explanations were fascinating and really easy to follow. It's a good read for anyone.
And I agree with you. I think telehealth is probably the thing that gets impacted the most because they reduced the security requirements, which I think they have since upped. But I think CMS is actually going through those categories right now and determining which ones actually added value. And they're going to try to include those in their overall funding, and which ones didn't add value. And they're going to try to, and they're probably just going to let those lapse, I think is how they're thinking about that. So I think the telehealth aspect to me is the one I would keep an eye on.
Yeah, the site of service was the biggie. The way they eased up on where the patient needed to physically be to allow them to be at home. And truthfully, I don't see them doing away with that, but technically it could go away. Everyone who said the toothpaste is out of the tube on telehealth, if you listen to folks like Maury Savickas from Chime, she will say, oh, absolutely, it is not out of the tube. A lot of this stuff could easily go right back to the way it was if legislation isn't changed.